Okay, this is a video for an integrative manual therapy treatment protocol for the left hip area, the left pelvis, specifically for an area called your sigmoid colon. So I'm going to explain it. If you're getting this video, you're probably one of my one-on-one clients or in our Atomic Success Secrets group. And so you already know me. My name is Ralph Havens, physical therapist and a healer. And let's get right to it. So if you're dealing with a hip problem, something that's hurting in this area or the side or in the back or down the leg or something in that left side of your body, this is a thing that could help. So there's a colon, part of your large intestine that's right here on the left side, and then it goes around and sometimes it winds all over the place and then it heads out your body. So in that left side is a big structure, and it's sitting right here. So here's the left side of the pelvis, and this is where the sigmoid colon sits. So you can see it's right in front of the hip joint, or right behind the hip joint. It's right in front of the low back area. So lots of nerves coming here. So this can really glue this area down. So I'm going to show you a series of treatments that you can do. Now the first one is called the compression syndrome. And what you do is you're going to find this little bump on the side of your pelvis, and you're going to find your pubic bone, and you're going to push this little bump, it's called your ASIS, you're going to push it towards the back. So if you're just sitting down, you're going to push it in a little bit with a few fingers. And then the pubic bone, you're going to push it in. And then this one, as you're pushing it in, you're also going to push it this way. And we're talking just a few grams of pressure, very, very lightly pushing in, and this one pushing a little this way. So on the body, it's going to look like this. Pubic bone, the little bump, I'm going to push in, and this one is also going to push this way. Push in, and then push in. And hold it for about a minute. You can hold it a little longer, and it releases the compression in this whole area. Now, the next one is a very simple technique, and what you do is you put one hand on the sigmoid colon, the pelvis. Here's the little bump, here's the pubic bone. One hand here. And then the other hand, there's a little divot. So if you slide your hand down your breastbone, you're going to come to a little divot. If you're wearing a bra, you might have to go underneath and just find that little divot. And right at that level is rib 6. And so then right below it is rib 7. And all you got to do is place your arm across your body and just let it rest there. So there's some things called reflex points, synchronizers, and if you touch there and touch on your sigmoid colon and stay there for 5 minutes, you can stay there longer, for 10 minutes if you like, 15 minutes, you may perceive some movement. Some things could be happening under your hands. If you don't feel it, it's okay, it still works, but it's a very simple way to help release the sigmoid colon and that whole pelvis area. So there's another technique. You could also do these other reflex points. You go down and find the little divot. And for those of you that want to know where that is on the skeleton, it's right here between your sternum, your breastbone, and the little xiphoid bone, right there. And so you slide, it's easy to find. You slide down, and that's rib 6. You go over here, when you're on the side, that's rib 8. So rib 8, and you go up 7, 6. So we're going to go 6, 5, and 4. Just put your hand kind of under your armpit. And the other hand goes on your sigmoid colon and stays there for 5 or 10 minutes. You can stay there longer. So you've got this position, and you also have this position, and then you have the press in, and press in thing. Now the next technique is something called disruption of membrane technique. And what it is, it helps the integrity of the colon. So make sure the walls of the colon are strong and can move easily. And it's a very simple technique. You can use it anywhere on your body, and you put your hands, here's the bump, here's the pubic bone. The hand goes right there, and then you twist your hand, twist the skin, and you're going to pick the easy way the skin moves. So in this case, the skin moves a little easier this way. I'm going to take the other hand, and I'm going to squeeze my fingers here and the heel of my hand here and squeeze that hand. Just like that. So it's a really simple technique, And you stay there for a minute or two, and then you move on and just move over to the side. Wherever it aches, you can try it. You put your hand down, you twist it, and then you squeeze. And so a minute or 2 minutes per spot. Just put it down, twist, and squeeze. So try those. I'm also going to put a link in the description of a strain counter strain position for the sigmoid. It's another video I made. So try that if you have left-sided pelvis pain, hip pain, low back pain. If you're seeing me and I've given you this video, it's because I thought it could be useful for you. So give it a try, sigmoid colon. All right, this is Ralph Havens, physical therapist, and there'll be links below.